Okay, this is the second most important technique in osteopathy, so you must know it well inside out. It's the supine multiaxial rotational osteoarticular technique, and I want to go over, while you've done it all and you practice it, I want to go over what are the most common mistakes the students make, so you don't make that and you prevent those mistakes. It's the most therapeutically effective, so you must do it for all patients. It's mandatory unless there is a contraindication. If there is not, you have to do this for all patients. Okay? First of all, this is the most common mistake I see the students make, is the hand placement. And how you find that if you are placing your hands correctly or not, look at now. Do you see her ears? No. If you see patient's ears, mean your hand's not correct. So first thing you check, do I see her ear? If you see, you say, oh, remember, my handsome Professor Dr. Pourgol told me not to do that. So check that. Second, which side am I going to treat her? Anybody can tell which side? No. Because with my hand position, you should not be able to tell which side I am. But if you are like this, that means you are wrong, because clearly it shows you want to treat the right side, but that shouldn't be. Your left hand, your right hand should be at exact same position on the patient. Not this one ready, not this one. Right this. You should not be able to know the difference. Okay, like which side I'm going to do. Number 3 mistake. The students start the work at neutral position. That's not good. If they do that, they cannot get a lock. You have to start at forward flexion. This is neutral position. Okay, some students start at that. This is not how you start. This is forward flexion. You see the difference? Everybody gets that? Forward flexion is the first step in treating. If you don't forward flex, you're not going to get the lock, and if you don't get the lock, you're not going to cause the ligaments to stretch, the facet joints to open, and you are basically doing massage, which is okay, it's good in some cases, but you are not doing osteopathy. Okay? Now, the most common mistake a student make is the next step. Lateral flexion of the head. A student laterally flex the neck. There is a difference, and that is why so many students don't get this technique right, because they laterally flex. This is lateral flexion of the neck. You see how much I go, how much my neck flexes? This is not lateral flexion of the head. You see the difference? On here, I will show you. This is lateral flexion of the neck. Don't do this. This is lateral flexion of the head. Everybody gets that point? Lateral flexion of the neck, no good. Lateral flexion of the head, good. Okay? So, the last mistake that the students make, they rotate, they do a pure rotation of the head. The last part is not a pure rotation of the head. It's not a 90-degree angle. It's a 45-degree angle. They rotate the head like this. And this, they cannot lock it. This is not. This is the rotation. You see how much I rotate? If you do more than this, or this side, if you go like this, you know that you're done wrong. So this is not on her, I'm showing. This is not the last part. This is full rotation. Now look at her. This is. You see? Just a little. That's it. So her nose, imagine if this angle here is not pure parallel to the body. It's at a 45 angle. I go step by step now, and then I do it regular. So your finger again on the posterior part of the TVP. In the cervical, there are two TVPs that you can palpate. The lateral part and the posterior part. One more thing. I always like 5 seconds at the end you hold, especially for lumbar and other areas. But in cervical, 2 seconds is for to give more energy to patients, 5 seconds toward more relaxation. But in cervical, I like 2 seconds because if you hold the neck in the position for too long, it may compromise the blood flow, and because brain is heavily dependent on blood flow, in some patients who okay, I don't know if I should delete that part or not, but really, that was a joke. That was a joke, you know. Hope she doesn't see the video, but so don't hold for 5 seconds. Hold it for 2 seconds. Okay, so first step, holding. Hold it. I'm treating the right side. So my finger on the posterior part of a TVP. You don't see it now, but I'm taking a skin slack out, put 10% pressure. My thumb is very important where it is, on the mandible. Do not put the thumb on the neck. You press her and block the arteries, patient feel dizzy, and then they feel you are damaging them. They get scared and they will not come to you anymore. So please always be mindful of where your thumb is. A wandering thumb is no good in osteopathy. You have to know where it is. Okay. So hold here. First thing, forward flex. Then while you're lateral flexing, you have to come 45 degrees. You cannot, this I forgot to mention, you cannot treat from here. From here is very awkward if I want to press. And your vector of force has to be in the same way as your body. From here it looks awkward. So you move 45 degrees while you do it. If you find it hard, standing is easier for you to practice. So forward flex, lateral flex of the head, and then rotation. You see how much rotation? That's it. It's not like this. If you feel like this, if you go more than like half an inch or 1 centimeter of rotation, you know you didn't lock the patient. You know you lateral flex the head or did something else wrong and you didn't get the lock. The lock is what causes the therapy. It's the lock. It's not the act of the movement. It is always the lock. You have to get the lock. You have to go to the end and hold it there. That's where the nerve endings get bombarded, things open, ligaments open, space open, they pressure on the nerve endings, and body produces hormones. Hormones go through blood and causes muscle relaxation, decrease in pain, and so forth. In osteopathy, you got to reach the lock. Otherwise, you are just acting. Oh, one more time. Stay here. Forward flex, lateral flex, rotate. Simple as that. Come. Go next step. Forward flex, lateral flex, and rotate. Next is 11. Forward flex, lateral flex.
So questions. So in the lateral flex also you're not taking full flexion of the lateral, right?
Full flex.
Like when you're doing the lateral flexion,
Yes.
it's not full flexion of the lateral.
Full flexion of
Full
the head.
flexion of the
You
head.
have to lock it.
Okay.
If you don't lock the lateral flexion of the head, the head, if it's a little bit, you cannot lock the rotation. So I lock it. I go like this. I feel with my hand. I can't go anymore. I feel it like I can't go anymore. Once I reach there, then I go. Not the. You must lock it in the lateral flexion.
Got it.
Okay, so I
Thank
do it
you.
one more time, like this, like this.
And you're
Very
moving your whole
relaxed.
Can you do it
torso
on this side?
Huh?
of your hands.
When you lateral flexion, you have to move.
Yeah.
Dr. Pourgol, can you do it on this side?
On,
Urge to be modeled.
we do everything. It's very simple. It looks complicated. 3 steps. Just remember: forward flex, lateral flex, rotate. Forward flex, lateral flex.